A warm welcome to all the colleagues that join this next webinar in the series of the technical webinar on climate change and health. Today, we are delighted to be organizing a webinar on a very important topic. So the title of our webinar is WHO Support for the Green Climate Fund Country-Driven Programming for the Health Sector. And of course, we will be focusing specifically on two regions, on the African regions and the EMRO region. However, this is an important webinar for all the regions worldwide, since the colleagues from the GCF will present us on the important modalities of the new GCF readiness function. Just before we go to the agenda of the meeting, next slide, please. I would like to inform you that we will be having the interpretation in 5 languages. It's English, French, Spanish, Portuguese, and Arabic. The webinar will be in English, but please feel free to choose the function that is more convenient to you. Also, please kindly make sure to mute yourself during the webinar, and please note that we will be opening a Q&A session. So if you can please go to the next slide. So as you can see, we will be starting with some opening remarks from Elena Villalobos Prats, and then we will be hearing from the regional colleagues in the African office. Then we will hand over to the GCF colleagues to drive us through the new GCF country engagement mechanism. And then, as I said, we will be opening a Q&A session. So in this one, please feel free to pose your questions on the Q&A function or the chat. And also, we will be giving some opportunities to pose your questions orally with a raising of the hand function. So without further ado, I would like to hand over to my colleague Elena Villalobos Prats, who is the Country Support and Capacity Lead at WHO HQ. So Elena, over to you.
Thank you very much, Antonis, and thanks so much for the support and the collaboration with the Green Climate Fund. For WHO, it's very important, this webinar, because we became accredited as a delivery partner to the Green Climate Fund for readiness projects in 2020. And since then, we got 5 projects approved and under implementation. We have additional 4 projects that are waiting to the signature of a collaboration agreement with the Green Climate Fund to start being implemented. And then we have additional 2 projects in the pipeline. As most of you know, potentially by now, there has been a change in the process for submission of Green Climate Fund readiness projects. So basically, this webinar will give you and us more information on how things will work at country level from now on. Just to mention that for WHO and the overall health community, we see that there is a need for further supporting health overall. We think that health is the argument for countries to basically get increased ambition in climate change action, both for adaptation and mitigation. And we very much welcome the support that the Green Climate Fund has provided until now and is intending to continue providing to health. So basically with this, I will just like to reiterate our appreciation to the Green Climate Fund and to thank all of you for being part of this important webinar. With this, I hand over to you, Antonis.
Thank you so much, Elena. And without further ado, I would like to hand over to the next speaker, who is Professor Brama Koné, who is a technical officer on climate change and health from our WHO office in the African region. So Brama will talk to us about the regional priorities for climate change and health in the African, focusing mostly on the African region. So Brama, kindly over to you.
Thank you so much, Antonis. Hi, colleagues. Happy to be here and exchange with you. Thank you so much for the Green Climate Fund team for the support going on. So can you kindly share the slide, please? Yeah, thank you so much. So I will be going through a few elements related to the priorities for our region, the African region of WHO. As you may know, the African region of WHO is not made of all the African countries. It's only 47 countries. And in the Mediterranean region, only Algeria is part of the African region. The other countries are part of the Euro-Mediterranean countries of WHO. Next slide, please. So you may have heard it, and this is the reality. Climate change is the greatest threat to our global health in the 21st century. And all human activities are affected by the global warming. And as you also know, Africa and few other developing regions of the world are least contributors to greenhouse gas emissions. But unfortunately, they are facing the most impact due to their high vulnerability. And this vulnerability is related to the socio-economic conditions that is lowering their adaptive capacity. And there is a growing attention now to health in the global discourse on climate change, which was not the case the past 2 decades. Next slide, please. Some of the key challenges we are facing in our region to tackle climate change impact on health can be grouped under 3 themes. The first theme is the limited human and financial capacity to build new knowledge and resilient health systems. So limited human and financial capacities to cope with climate change impact on health. The second one is the limited weather and climate data, health and climate data, we shall say, that should be used to inform coping strategies. Indeed, the challenge for health and climate data and weather data was almost the same 2 decades ago, but due to the evolution in the availability and use of satellite data, the challenge for weather data decreased a bit, while in developing countries, the challenge to access health good recorded data still challenging today. So yes, we still have a challenge there. The third and last key challenge for our region is to raise the health leadership in climate adaptation. And this is a challenge going beyond the African region. This is globally a challenge worldwide. The need to raise the health voice in the international debate on climate change. Next slide, please. What have we done in the African region? The nearest possible we would like to start is from the Libreville Declaration on Health and Environment in Africa. That was signed in 2008 by all Africa. And here I'm not talking about only the WHO region of Africa. No. I'm talking about all Africa. The 52 member states have signed a declaration in 2008 in Libreville to advocate, to encourage, and to push forward for the integrative work between environment and health sectors and all interconnected sectors like finance and others. And from 2008, we went in 2011, where the first framework for public health adaptation to climate change in the African region was adopted by the member states at the Regional Committee for Africa. This framework have been used since 2011 to 2024 and was the main guiding document for the work on climate change and health in the African region, in addition to all other documents that came from the global office at HQ of WHO. In 2022, we updated in the African region our strategy for the management of environmental determinants of human health, including, for sure, climate change. And in 2023, we got the operational framework for building climate resilient and low carbon health system. That was a global framework. And from this global framework, our African region submitted and adopted a new framework that will continue guiding the action of climate change and health in our region. And this framework is to build climate resilience and sustainable health system in our region. Next slide, please. What are the key recommendations and action points that came from this framework? One of the key recommendations is to translate international agreement on climate change and health into national policies, strategies, and action. So this is calling for how, from the global perspective, we can get down to countries, how to take global decision, global agreement, and translate them in national institution, in national law. The next key recommendation and action point is to revitalize the implementation of the Libreville Declaration on Health and Environment to support climate adaptation and resilience building. Through the Libreville Declaration, many multi-sectorial working groups have been established in African member states. And there is a need to revitalize some of these working groups so that they can tackle efficiently and effectively climate change impact on health in these member states. The third key recommendation and action point is to reinforce climate change and health technical capacities at the regional and country level. You may recall that among the weakness and the challenge, we talk about the need to increase the financial and technical capacities. So yes, we are reinforcing climate change and health technical capacities at the regional and country level. The fourth action point is to build scientific evidence. So we support the building of scientific evidence in our region with the support of HQ in collaboration with HQ and with country offices of WHO. We support scientific research and new knowledge development to tackle climate change and health in our region. The last and not least point, and this is why we are here today, we are supporting countries to mobilize financial resources for adaptation and resilience building. Next slide, please. And all this is mainly done in the frame of our new Alliance for Transformative Action on Climate and Health, which is attached, and as you may know, which was settled in Egypt following the COP26 Health Initiative in Glasgow. The next COP, we have seen the settlement of the ATTACH, which is an instrument to support countries implement the COP26 Health Initiative. And until now, from almost 90 countries in the world that have committed to implement the COP26 Health Initiative, so that are part of ATTACH, 29 are from the African region, and we continue advocating to increase this number. And the African countries are actively engaging in the ATTACH and other climate change initiatives, including the work on air pollution impact on health in our region. So these are the few points we are quite happy to share with you to show you what we are doing in our region and how it's really important to get these kind of sessions where we can exchange on how to mobilize the resources, including the Green Climate Fund resources. Thank you, colleagues, and over to you, Antonis.
Thank you so much, Brama, for this excellent presentation. And I think it reminds us all on the necessity of identifying the necessary resources to support this very important work throughout the world, but specifically also for regions which are highly affected by the effects of climate change on health. With that, I would like to kindly invite and take the opportunity to thank again our GCF colleagues. So I would like to invite Madam Chihenyo Kingara, who is the regional manager from the country programming department of the African region of the Green Climate Fund, to give us a presentation on GCF's country engagement mechanism. So Chihenyo, kindly over to you.
Thank you so much, Antonio, and the WHO team for inviting me to make this presentation. The presentation will focus on country programming, approaches and mechanisms. Next slide. So I am one of the country coordinators under the Department of Africa, and we really are interested in ensuring that countries benefit from understanding some of our programming approaches based on various pertinent areas of interest. Next slide, please. This is just to introduce the presentation. As you're very much aware, the Green Climate Fund is a catalytic fund intended to be really country-owned, country-led, and country-managed. We promote country programming basically through readiness, which supports country planning, as well as also building capacities in necessary areas that are critical for advancing climate finance. We see ourselves as an open partnership organization. Most of the programming is done through accreditation, but in addition to that, accreditation is not the only way of working with the GCF. We also utilize a range of financing instruments. So we're leveraging blended finance with other instruments so as to bring the results to fore in various countries, where the programming in generally is really balanced, 50-50 allocation going towards mitigation and adaptation. We also see ourselves being able to take risks through risk-taking patient capital that allows us to actually be able to program additional higher risks so as to be able to bring early stage project development. Next slide. So where do we focus? We particularly focus on both adaptation and mitigation. So in terms of mitigation, we are here to reduce emissions, looking at energy generation and access, transport, building cities, as well as forest and land use, as well as also health. We're looking at increasing our resilience, livelihoods of people and communities, health, food and water security, infrastructure and the built environment, ecosystem and ecosystem services. These are just some of the areas that we actually focus on in our programming. Next slide. So as part of the delivery of our updated strategic plan, as well as also as part of the overall delivery of efficiency within the GCF, the Vision 5030, as it's well dubbed, we are now pivoting towards key principles. Continue with the slide, please. And some of these key principles include country-centered approach towards readiness. So prior to some of these changes we're making, we were known to be very silo-centric, but now we're moving more towards country-centric programming, and we are focusing with readiness, looking at readiness in support of building credible pipeline through origination and country ownership. We're also promoting systems thinking and programming approaches, moving away from grant to grant incremental approaches. And as a fund, we also now see ourselves as being more effective through our Vision 5030. So through readiness, we are now promoting more strategic medium-term planning for the next 4 years. And you'll hear more about our readiness approaches in our next presentations. Next slide, please. If you could bring up the entire slide as well. So in terms of our program cycle approach, we are utilizing readiness to support programming, but we're also deploying it more intentionally to enhance our origination of the GCF pipeline based on the country program, but really bringing out country needs and priorities. So within the first stage of entry of programming within the GCF, readiness is quite a tool that can support better delivery of country program documents, but also teasing out the important capacity needs at that level. Next slide. So at the country level, especially particularly for the African continent, various investments have been articulated in utilizing various data points. We are aware that for Africa particularly, 2.5 trillion US dollars is needed. And this is UNECA's studies have shown that until 2030. And I'm sure also similar studies have been done for other areas, particularly in the MENA region and other areas where both SIDS and LDSs reside. So when you look at the national determined contribution or the national climate change policies and action plans, it is critical to also ensure that more mainstreamed integrated programs are identified so as to package investment priorities adequately. So at the country level, various areas have been identified: disaster risk management, food and nutrition security, water and the blue economy. And for today, of course, what's more important is the health, sanitation, and human settlements. These are all pertinent areas, but again, integrated program will be critical when climate investment priorities are packaged. Next slide. So at the country level, GCF is supporting programming going forward by addressing key challenges that have informed our updated strategic plan. What we have noted to date are that there are numerous challenges with regards to funding channels. There's also imbalances in allocation, also lack of capacity to develop bankable proposals, and the need to have better coordination across agencies and stakeholders. So in moving forward, we are interested in ensuring that climate finance strategies at national level takes into consideration better coordination and collaboration. And I'm glad to have heard this morning here that we are talking about coordination across various streams and various sectors at the national level. Also, we have noted that there's need to establish a criteria that identifies mitigation and adaptation interventions, as well as also strengthen national financing systems. But to bring this all together at the national level, there's also there's really pertinent urgency in establishing and strengthening platforms for stakeholder dialogues. And that brings us to the next slide. The benefits for country dialogues and country programming are eminent. And we really would just like to highlight here the need for enhanced coordination amongst government agencies, private sector financiers, and international partners to really bring out the various investments and to ensure that the needs are met. Systematic approaches are also critical in integrating economic, financial, health, environmental, and technical objectives. Furthermore, the need to simplify and accelerate action and impact by aligning financing instruments and programming with prioritized projects and removing roadblocks to fast-track implementation. Next slide. So what I'd like to present here is just some guidance around programming. This is not intended to be prescriptive, but this is just to support processes that will be necessary as you develop country programs that are important for programming at the national level, but also how to ensure that health parameters are also further considered as part of multi-sectorial processes and intentions. So at the national level, what will be critical is to identify climate result areas that also align with the GCF support. And when you do have conversations with national designated authorities that are assigned across countries, they definitely facilitate these processes. But it's also important to ensure that these dialogues also mainstream health concerns. Then secondly, at the national level, to be very critical to define key priorities per sector, or where possible, to ensure that there's integrated basis, or where more possible, to have core benefits between health and other parameters, as well as also between health and public and private sector inputs. At the national level, as much as we're also just talking about health, we must also take cognizant that there's importance to rank these priorities across both mitigation and adaptation targets as aligned with the national determined contributions of the country, as well as also the national adaptation plans. Lastly, it will be important to also list out your proposed interventions together and in collaboration with other actors, so as to be able to ensure that there's great utility of the range of green finance instruments at the disposal at that level. So we're calling for broader multi-sectorial consultations between the NDO, the National Designated Authorities, GCF, and accredited entities, as well as all other actors at play at the national level. And this is intended to validate priorities and ranking against our priorities, as well as also national priorities. And also the importance of these multi-stakeholder consultations to ensure that discussions deploy various financing instruments. So as you start drafting your country program, it is important to ensure that the situational analysis takes into consideration consultations, and that the sections around this really contextualizes what is happening at the country level and how that is aligned to national policies and strategies with regards to climate change. Next slide. So the program guidance also notes that in the narrative, which is really intended to be not more than 12 pages, that you cover areas with the country that looks at country context. Secondly, areas around climate finance strategy and priorities, really borrowing again from the existence of your NDC, LTS, or NAP. And then lastly, looking at progress in implementation of the existing portfolio, the GCF portfolio, and the various lessons learned. And the intention of this is to ensure that at the country level, various lessons are informing how climate finance can be simplified, but also how effective the delivery is in ensuring that it reaches the most marginalized. Next slide. Again, as you look at guidance on country programming, we also would like to see evidence in terms of analytic work that informs the program. So how have you prioritized these projects for climate impact? So in this section, it will be important to draw out the various data sources that highlight climate hotspots. A vulnerability impact and adaptation assessment is a critical analysis that can inform how various climate hotspots have been identified, and how you've also identified cross-cutting themes that will be integrated in all projects. The country program also requires climate result areas and identified projects. So it would be important to propose what these areas are. So here we're contextualizing what is critical at the national level. So you would need to look at broadly 3 result areas, and each of these result areas would need to also cover readiness and preparatory support, proposed project narratives, as well as also opportunities for complementarity, co-investments, and strategic partnerships. As also mentioned earlier on, regional and multi-country programming is also important, and therefore where there's need for such, then there'll be need to also ensure that some sectional or a narrative is included so as to harness unique opportunities as seen. Next slide. So this country program guidance is on our website, but if I just want to mention that the most important part of it is actually your results framework or your results matrix. So it is important to be able to demonstrate the results framework using a logical framework approach. So within the country program, it is intended that you would adopt a cycle approach and you'd be able to show how various results will be attained at various levels. Another critical element to this country program is that you would need to also put in what risks might be attained throughout the cycle and how you'd actually be able to circumvent these risks as part of delivery of the country program. Next slide. So what really is important in defining a fundable GCF project from a climate change perspective? We have to really define the difference between a climate change project and a developmental project. First of all, it's important to identify what exactly is the problem. Is the problem a climate change related problem or is it a development problem? What we're presenting in front of you here are the various steps that are necessary when you're thinking about an adaptation project. So step 1, do you have reasonable evidence that the climate change is a contributor to the worsening performance of a sector, infrastructure, community, or ecosystem? As I alluded earlier on, I talked about a vulnerability impact and adaptation assessment. Such an analysis helps you to tease out particular areas that are vulnerable by overlaying various data points that attributes towards this. Now, this is an index that has come out through the UNFCCC, and I would also recommend that you take time to look at the VIA or the Vulnerability Impact Adaptation Index so as to be able to drive such a study if needed. So step 2, when you're looking at your next steps on whether it is a development or a climate change problem, you have to also ask yourself, do you have evidence of a solution which can effectively address the climate change contribution to the problem? And if you don't, then that might not necessarily be a project that needs to be funded through the GF. But if you do, then you need to move to step 3. Do you have evidence that concessional finance is needed to implement the climate change solution? If not, then again, this that kind of a project might not be for GCF. And lastly, of course, is if you have that evidence for concessional finance needs, then GCF may need to consider this project. Next slide. In terms of mitigation, again, we have a similar trajectory on how projects are financed. So first of all, you need to ask yourself the simple question. I want to avoid to reduce GHG emissions. Okay, we're here to help. Step 1, can the proposed project be implemented without concessional finance? If it's yes, then are there barriers that prevent the implementation of the project proposal? If they aren't, then you cannot finance that project. Again, if the proposed project is to be implemented without concessional finance, can similar activities to the proposed project be observed without concessional finance? If the answer is no, then this project is additional. What are we looking for here when we're looking at mitigation? We're looking at additionality as well, so that we can be able to confirm that GCF can actually finance that project. Next slide. In terms of country programming, one key approach or mechanism are the country platforms. Next slide. What are these country platforms and what are we trying to imply? As climate finance continues to dwindle and as climate finance continues to be pertinent to various countries, the need for multi-sectorial coordination at country level is critical and paramount. There are already existing multi-sectorial coordination platforms in various countries, but at the same time, they might not necessarily be able to support mobilization of the adequate or necessary climate finance across that country. And therefore, going forward, we would be keen to support country platforms as a pertinent platform that brings together various actors and driven by the NDA and other actors. What we see key outcomes as country platforms are that these platforms really support a more structured approach or mechanism for mobilizing finance and driving the required necessary systemic reforms. Furthermore, we also see that country platforms could also support inclusive governance for equitable outcomes. So they're necessary to really bring in the just transition measures that are necessary across the various sectors so as to have more strong governance structures to ensure transparency, accountability, and trust. It's also through these country platforms that we can be able to promote more innovative financial structuring that also could bring public and private finance in a more programmatic and catalytic way. So there are various outcomes that are being seen through country platforms, and we want to be able to see these taking more shape with more health attribution at the country level. Next slide. We are taking time to bring this to this webinar because we do see that going forward, that even health practitioners need to find space in country platforms because these country platforms act as coordination mechanisms that could also fulfill several core functions. So in terms of coordination of key stakeholders, the platform and the platform secretariat, ideally facilitated through the national designated authority, could also support translation of country commitments and ambitions. So for example, the national designated contributions, the NDCs, the NAPs and the LTSs, and also health sector documents could then be able to be teased out into key priorities and into programming. We also see that these country platforms could also enhance stronger catalytic financing at large scale by ensuring sustained investment engagement, also supporting and promoting structuring investment opportunities and providing strategic support to tackle barriers to capital deployment. So there are key functions that we see country platforms could really help. And if they're not in existence in your country, then the role of the NDA can also be enhanced to ensure that they could drive this platform so as to be able to benefit and also drive the delivery of health benefits. Next slide. So continue with the slide, please. So again, just to hone in as we move on to the next presentation, I'd like us to bring us back to one of our key instruments, and that is readiness. It's through the Readiness Programme, which is seen as, by and large, as the largest capacity building instrument and program that we as GCF are able to drive country programming. I would like to turn this over right now to the next presentation. But before that, I would like to end by saying that by the deployment of more intentional readiness, then we'll be able to support better origination of ideas and proposals that could get into our pipeline. And more so, we can then be able to see more health results and benefits at national and country level. I'd like to end there, Antonio. Thank you so much.
Thank you so much to you as well, indeed, Chihenyo, for this very well articulated presentation. And without further ado, I would like to hand over to our next important speaker, who is also coming from the GCF. Dr. Ram Subramanian will give us a presentation on the new GCF readiness operational modality. So Ram, kindly over to you.
Thank you so much, Anthony. Good morning, good afternoon to everyone. And thank you, Chihenyo, for your presentation and to link the readiness. I will try to summarize, take from what Chihenyo has highlighted about the country programming and the focus on country origination, country coordination, and then to take you through how readiness can be useful for WHO to engage with countries in terms of implementing some of the key transformational shift that you can do in the country by integrating health and climate change. Can you move to the next slide? Yeah, move further, next. This is the outline. I have 20 minutes, but I'll try to summarize in 15 minutes so that we can take more questions. Next slide. Yeah, move further, yeah. I don't know how many of you are familiar with readiness. As Chihenyo pointed out that readiness is the GCF readiness program is the world largest capacity building program on climate change. And I think we are celebrating 10 years of our experience of rolling out this program globally. Ever since 2015, the first grant was awarded. And we have been having 10 years of continuous experience supporting countries in addressing climate change related issues. There is a significant amount of evolution and learning for last 10 years. We have been supporting 142 countries, working more than 200 plus implementing partners, and we have around 800 plus projects, readiness projects supported globally. The key focus for us so far is on support to NDC, the Nationally Determined Contribution, NAP, the National Adaptation Plans, the long-term strategies towards low emission reduction strategy, and other national climate finance policies, frameworks, and strategies. Close to 55% of the support so far we have provided to SIDS and LDCs through readiness, and almost 40% of our portfolio is supporting close to 120 countries in devising the National Adaptation Plan. Currently, 107 countries are already implementing NAP, and maybe around 12 to 13 countries are going to benefit from NAP support in next 1 week time frame. Next slide, please. This is the overview of the current portfolio at the moment. Like we have close to 800 projects. We have approved close to 700 million US dollar. Almost 60-70% of the project are in implementation at the moment. And as I mentioned, we work in close to 142 countries implementing this huge portfolio of readiness. And Africa comprises of almost 1/3 of the entire resources that we are developing. Africa, Latin America, and Caribbean, and Asia Pacific. Each we have 1/3 of readiness implementation, and Eastern Europe and Middle East as 10% of allocation so far. Next slide, please. And if you see here, you can see on the left, on the right, the portfolio of WHO, GCF WHO portfolio. Currently, we have 9 projects approved, but 4 projects are under legal processing. 2 are completed and 3 are under implementation. We are supporting close to 4.5 million US dollar, and the projects are working in 8 countries. And this partnership quite new, as far as I understand. And we are also negotiating with WHO on the framework agreement, where already we have around 12 organizations that we have a framework agreement. And this framework agreement, you don't need to sign grant by grant agreement. You can, this overarching framework will help you to implement readiness in many countries. So we are still in negotiation of the framework agreement at the moment. The readiness, in terms of readiness needs, I think the first 2 presentations set the scene for this meeting, and I would touch base a few of the elements in my presentation also. The health-related NAP, that is one core area, health sector resilience to climate change, FCAS, we call it as the FCAS, which is Fragile Conflict Affected States, and multi-country initiatives on health and climate change. And also an emerging area which we are looking at is South-South cooperation, how we can use readiness to promote South-South cooperation in countries where there are transboundary issues which can be addressed. Next slide, please. This is the new readiness strategy. I'm sure that you might have been familiar with new readiness strategy. There are a number of events which we promoted in the last 6 months. We are almost in the operationalization of the new readiness strategy at the moment. So what we are trying to do differently now, we introduce a number of reforms in the new readiness strategy, which includes the 4-year integrated readiness support planning by the countries. And this is a multi-year programming approach to readiness. Earlier, we used the readiness on an annual basis. That leads to fragmentation of projects. That's one of the reasons why we have 800 plus projects in the past. Now we are trying to focus upon 4-year cycle, and then the country can access the entire 4-year cycle at one go through the new readiness modality. I'll take you through the budget envelope and the modalities that we are looking at the moment. If you see from the screen, you have 4 million is the country allocation that we have at the moment. And we also support countries for 3 million under NAP. As I mentioned before, there are close to 120 countries are already implementing NAP. So we see that may be very less uptake. There are only those countries which have not came to us for NAP, devising the NAP or updating the NAP. The rest of them will be focusing upon implementing the current NAP project that they are already engaging in, and then focus upon the NAP implementation in the years to come. So the 4 million is what is the country allocation that we have at the moment for this 4 years. That will be implemented through country window. Just a second. And then we have other modality called DAE modality, which is direct access modality, where we support the direct access in the country, the direct access entities, to strengthen their programming capacity and implementation capacity so that they are in a position to implement GCF funded projects as soon as they are ready. Next slide, please. And the overall budget is around 500 million for the strategy approved by the board. And approximately 410 million is available for the country window. And the balance is for DAE, the direct access entities, supporting direct access entities. We also have a placement scheme for LDC and SIDS, where we are deploying a liaison officer to support countries in engaging with GCF and to access more climate finance. We already placed 2 such placements in the last 1 month, and we are focusing on, I think we are working on 50 countries to place this liaison officer in the next 2 to 3 months time frame. Next slide, please. This is broadly the financing modality, which I briefed a little bit before. So in the new readiness, we streamlined the objectives of the entire readiness program. Earlier, we had 5 objectives. Now we're streamlining into 3, focusing on the objective 1 is focusing on capacity building for climate finance coordination and enabling environment. Objective 2 is clearly focusing upon programming for adaptation and mitigation. And here, the intention for us is to how can we increase access to climate finance to countries using readiness. So it's clearly targeting heavily on projects, preparation of projects, identifying opportunities for investable action in the country and related things. And objective 3 is focusing upon knowledge sharing and learning. And these 3 streamlined objectives are supposed to be implemented by country modality, which I mentioned, 4 million, and then the DAE modality, which is 1 million per entity for 4 years. In the country modality, as I mentioned before, if you include the NAP, the National Adaptation Plan support, then the additional 3 million is included. And this 3.32 is for the placement support. The SIDS and LDCs countries will receive additional assistance of $320,000 for the liaison officer position to be filled in those countries. So this is broadly the financial envelope that we have to support countries. And then NAP implementation, we are also looking for those countries who are advanced in the implementation of NAP. They can also, once they exhaust the 4 million of, once they commit the 4 million of country window and use the 3 million of NAP, implement NAP window, they can also request for NAP implementation. The trigger is $250,000 that less than the committed one, where they can seek support for NAP implementation. Can you go into the next slide, please? So this is the multi-year programming that I indicated. So we recommend countries to come up with one program or two program maximum, so that we don't want to have multiple projects running around by many entities in the country. We would like to streamline this approach to have engage with country at the moment, discuss with them on their strategic priorities for 4 years, and then devise the program based on how the needs of the countries that they are expressing it out. So that's what we are talking about: 4-year strategic planning with 1 or 2 program, and using this 4 million window, minimum of 1 million and maximum of 7.32 is illustrated here for the sake of NAP for those countries which have not accessed our NAP support. Next slide, please. And this is the process. Probably for you, what is relevant as if you're going to be a framework agreement partner, the countries are at the driving seat of readiness. That's the strategical the reforms that we have at the moment. A country decides based on their needs. They can take 3 routes. One, they can decide that they wanted to implement on their own. That's a direct access route. And if they have the capacity to implement readiness on their own, they decide and they come to us, and they can implement directly, either by the NDA if they have the capacity, or by the designated authority in the country. It could be any entities which has legally can sign and which has capacity to implement readiness projects in the country. And it could also be a direct access entity who have already accredited and they have the capacity to implement. We have few examples in Africa where direct access entities are implementing both readiness as well as funded activity projects. Then the next option that we provide is the framework agreement partners route. Because we have already signed a framework agreement partners with 12 entities at the moment, and they largely implement 60% of the readiness portfolio of the legacy, and they also wanting to engage in the new readiness framework. And then we allowed country to decide which part of the needs that they wanted to engage as framework agreement partners. Do they wanted to implement the entire readiness through framework agreement partners, or do they wanted to focus only on specific components of their needs which can be fulfilled by framework agreement partners? So that choice we left to the country to decide upon. And that's where I think the space for WHO to engage with country and negotiate, if the country identified health as a key priority to be addressed, then there is a space for you to negotiate how you can address that needs by either being a designated authority or engaging with the country to evolve the proposal. The third route is about the hybrid approach, where the options. The third one is on the LTA work order is about. We also shortlisted through open competition. We are also shortlisted close to 50 or 60 odd entities who have capacities to implement readiness. This is more like a commercial companies. Some are not commercial, but some are private companies who have sectoral expertise, who can bid for this tender when a country expresses the needs. When the TOR is up for private sector player to operate, then this option is open to them to apply through a mini tender process. So we have 3 distinguished routes, and then the NDA can choose which one they wish to opt for. So for WHO, I think the FW, if you are not at FW partner at the moment, the NDA can designate WHO, or in the meanwhile, if you're getting the framework agreement signed, then you can also be qualified to negotiate with the NDA and find space to implement through that approach. Next slide, please. And these are all the set of toolbox and the template that we already you can see in our. I can show you the slide, the last slide, which takes you to the web page. So we have, if you go to Google, if you type GCF readiness, I think you will hit the readiness web page of GCF, and you will see all the templates and tools that is available for you to access. And this is the first step in the process of request for support. This is the country first request us on the readiness support in the new modality 2024-27. And then they identify whether they want to go for one program or two program, and they sketch their request to us. Next slide, please. The next step is about the strategic medium-term planning, where country focus upon their critical needs in the 4 years in terms of taking stock of what readiness has already contributed in the country. We have, most of the countries, the legacy portfolio is still in the mid of implementation. For example, some of the countries where you work, for example, Mauritius, WHO is also working in the country on health-related adaptation. And we are also in the new readiness, the transitional window. There is an app proposal from the country, and we are also asking them to work closely with WHO on the health adaptation related interventions to be integrated. So we are also trying to take stock of what readiness is implementing already in the country, what emerging needs for the NDA to be addressed, and how this can be programmed in the 4-year planning cycle. So that's what we are trying to. And then who is the best delivery partner who can support the NDA in implementing the new strategic medium-term planning. So that's what the process is all about. Can you go to the next? And we have toolbox where the gating documents are there in the readiness web page, which includes templates, the terms of reference for the country readiness window, for the DAE readiness window. All this you can access directly from the web page. Next slide, please. So our preferred option is direct access, because we had experience of 10 years. As I mentioned to you, like 60% of the readiness has been implemented by international entities. And no, not 60, maybe more than that, 70% possibly. Only 20 to 30% are by the national and regional entities at the moment. So we prefer to, we opened up this opportunity for NDA to country and NDA and focal point to directly access. So that's a strategic priority that we set under the new readiness. But not all countries have enough capacity to implement the readiness. So obviously there is a role for framework agreement partners and other delivery partners to play a role. And so we kept it all flexible for countries to choose which entities that they wish to engage with. I don't think FMCA and other related information is relevant for you. It is only for those entities whose capacities have not been assessed. Then we have to do a financial management capacity, and then we provide readiness support. For WHO, I believe if you are getting the framework agreement route, then you can directly engage, and the proposal is approved, then you can directly implement the program. Next slide, please. Next again. The pre-qualified delivery partner route is what the NDA have to choose in terms of whether they identify some entity in the country, designated entity that country feels that, for example, if a country wants to implement through Ministry of Environment and Climate Change in the same country, and if the NDA is Ministry of Finance, the Ministry of Finance can designate Ministry of Environment and Climate Change, provided if they have legally can sign an agreement with us, and they can nominate or designate that entity, and we follow the process of helping them to prepare the terms of reference and proposal and getting it approved. That's a pre-qualified DP route. Can you go into the next slide, please? And the hybrid approach is about if NDA wants to implement the program, as I mentioned, we recommend 1 or maximum 2 programs per country. The NDA wants to follow a hybrid approach. For example, part of it that they want to implement on their own, and remaining part they want to implement through a framework agreement or by the long-term agreement partners, the the private companies who might be in a position to supply, efficiently implement some of the critical deliverable that the country is asking for. So that's a hybrid approach a country can choose, and they can decide how much amount of resources that they would like to earmark so that they can propose the terms of reference related to that. Next slide, please. For framework agreement partners, so there is no, so either you have direct access, that's the preferred modality, and then we also have the hybrid approach. That's what we also think that countries might choose in cases where they need support of either a framework agreement partner or an external entity like a private company who can bid for deliverables related to, for example, if a country wants a proposal to be developed on energy sector, it may be easy for them to prepare a terms of reference and launch, and then the long-term agreement partners, the mini tender, they can easily provide that in 6 to 9 month time frame. It will be more efficient if they can rely on expertise available in private companies who can deliver some of those high quality deliverables which they need within a short span of, say, 6 months to 2 years. So I think the NDA might prefer the hybrid approach, but we are not going to be prescriptive. We are going to leave that space to NDA to decide how they wish to implement the entire program. But there is a space for FWA in countries where they can also implement the ongoing arrangements through the framework agreement partners, which include UNDP, GIZ, GGGI, and other. If WHO is also accredited, you will also be part of the framework agreement partners. It's easier and quick because you don't need to sign an agreement. You already have a framework agreement with us. So once the proposal is approved, you start the implementation immediately. So that's our arrangement with framework agreement partners at the moment. Can you go into the next slide, please? Yeah, can you go into the previous slide? I wanted to highlight the country ownership. The country ownership is key because, as I mentioned before, we prefer direct access. That's what the learning that we have. We wanted to, as Chihenyo mentioned, we wanted to really strengthen the country ownership, the country coordination, and the country leadership. Primarily, that's what our reforms at the moment in terms of how we can support, strengthen country, be at the center of the readiness, and country be at the center of programming, and how they can access more and more climate finance through the capacity building support. So even if you move through FWA approach, we would like to emphasize that country ownership is a key for your engagement with the NDA and the country. Can you move into the next slide, please? And this is the website. You can go greenclimate.fund/readiness, and you will see all the windows. You can see overview, country window, DAE. So you will have all the information published there. You can also see some of the videos where we presented in many webinars. So you can also, even if if some of the colleagues wants to see some of the previous webinars, you can have access to all the documents in this web page. Can you go to the next slide? Right. I'll just summarize a couple of points which is very relevant for WHO. I think the message from the investment services team from GCF is for you is, yes, there is a role for framework agreement partners, and there is a clear role for organization like WHO for many reasons. One, health is not really a priority sector so far. We have seen so far health has not been identified anywhere in whether it is a national adaptation plan. If you really scan through the national adaptation plan, there is complete disconnect about the health related national adaptation plan. There is a huge opportunity to update the NAP in all the countries where the health can be integrated, or separate health NAPs can also be prepared. There is an opportunity which is still there. Then health related NAP guideline. Not many countries have clearer guidelines on how do we, this is emerging as a key priority post-COVID, because once you see that the vulnerability of the public health system, then they realize how critical it is when you are facing such pandemic challenges. So it's a really good opportunity moment for organizations like WHO to focus on how do we promote such guidelines at the country level to integrate health. Then climate resilient health indicators. That is one thing which we see not prominently coming up from countries in terms of identifying these so that you don't just mainstream, but you actually take a serious action account into taking health in your climate change issue. And then health adaptation project. So I am trying to see the connection between, once you integrate these, hopefully I think the countries will understand the need for more resources, and then they come to us for health related adaptation project or health related mitigation project. There is a strong connection to mitigation. As you know, if you take pollution, if you take GHG emission and anything related to pollution and anything related to the resource depletion that we see, which and the association with respect to health, which has not been widely advocated for. So on the mitigation side, there is also a clear link. So, but these frameworks are not there at the country level. So this is an opportunity where organizations like WHO can focus upon. Then policy side, so transformative policies, innovation in health technology and climate. Many of you are talked about the data. There's a critical gap in the data. So that's all from my side. And thank you so much for the opportunity. And I look forward, if you have any questions, please feel free to reach out to us. Thank you.
Thank you so much, Ram, for the detailed presentation and the precious information that has been shared. I think we should jump very quickly to the Q&A because there are a lot of questions. So I will kindly invite also Patrick Gitonga, who is the Senior Health Advisor at GCF. And thank you so much, Patrick, for also being with us today, along with Ram, Chihenyo, and Elena, to be together and stand together to try and reply to the several questions that I can see. I will go quickly first to some of the questions that I can see on the Q&A in the chat, and then we will hopefully give the chance for some hand-raising function. So the first question that I can see is, how can a country receive this funding and what are the requirements for the Green Fund? I think we have replied to that question mostly, but if I can kindly rephrase this question, because I think it is important for us. If any of you, Ram, Chihenyo, or Patrick, could give us a simplified example on what changes from the previous format in which WHO was a delivery partner and could directly propose thematic proposals on health to this new modality, with very simple words for our colleagues to understand what is the big shift in the process.
Patrick, you want to go or?
Ram, I believe that is a process question, so I would rather defer that to your expertise.
Sure.
It's really a readiness process question. What has changed? And what are the implications for health as a sector? It's not health specific.
Right. No, Chihenyo, you wanted to go in, or shall I go and you can pitch in as well?
I think you just take it, and I'll also chime in once you're done.
Sure. Yeah. See, the changes is actually multi-year framework now. Earlier, we had every year annual envelope, 1 million. The country comes with requests, we process, and it is a fragmented approach earlier. There are projects related to health. There are projects related to, I'll give you an example of Mauritius. We have health. WHO is working on health. FAO is working on agriculture. OCAPS is working on science-based data. And then there are another two more projects in the country on DAE and things like that. So now we are moving into a kind of a multi-year framework where country takes stock of what is the requirement for a 4-year planning, so that they have a full budget available, and they can decide what exactly they wish to do for a 4-year, which gives them a strategic overview of how they wish to address climate change in the 4-year. So that space is something the reform over here is like, we are not going to have fragmented approach on many projects. We are going to have 1 or 2 projects in the country, and within that space, how we are going to address multi-sectoral issues in the country. For health, we have not changed health anything before and new. In fact, we would like to have these sectors to be addressed more prominently in the new strategy. We don't want to go back into the same sector again and again. So we would be intentional in addressing some of those key challenges which NDA is focusing upon. The key driver over here, NDA, country, NDA, and and the region. For example, Chihenyo over here. So we have a country coordinator. So we want the narrative to be determined by the country, not by a delivery partner, not by AEs, not by others who goes and say that, hey, we will have this project, we will support. We want country to decide what they wish to implement, how they wish to implement, and then they identify, we need these 3 set of partners, and then, but you can match make. It's not, we're not saying that you cannot, you can really, you have already engagement with the country, and then you can find opportunities when during your engagement, how you can contribute to the requirements of the country using this opportunity. I'll hand over to Chihenyo.
So in addition to what Ram has just articulated, one of the slides that I presented talked about the pivotal changes that we're making when we're looking at country programming and also looking at readiness. We talked about moving from delivery partner-centric approaches to more holistic, integrated programming, and also using readiness to be able to promote that. We talked about systemic approaches than siloed ideology in programming. And the reasons why we're making these changes is particularly to be able to address priorities that have been mentioned in the national designated contributions, the NDCs, as well, determined contributions, as well as also the NAPs, the National Adaptation Plans, and also to promote core benefits across various sectors. So you might be thinking just health, but health also contributes to water indicators, what also contributes to ag food security, contributes to other sectors that are also critical. So we are trying to enhance more multi-sectoral coordination, collaboration, as well as programming, so as to be able to deliver and hit on targets that are mentioned on all these national documents that are pertinent to countries. So as Ram just articulated, to be able to strengthen country engagement or country voices at various levels, we have to think about programming, but at various aspects, programming that brings various sectors together. And readiness can be deployed intentionally to do that. I saw in the chat the call to ensure that we have the right health indicators to be able to contribute towards various dialogues that are happening at country level. I mean, one of the issues that we clearly see is an eminent gap in many of the discussions that NDA is having with various actors. We're seeing the gap of health practitioners participating in key dialogues at country level. And I think you also, those who are on the ground can also say the same. But to be able to strengthen our engagement at country level, whether it is supporting the national adaptation planning processes or also informing health dimensions in other key sectorial documents, I think it's important to ensure that these relative national and regional health indicators are understood by all. And to get us there, there are a couple of analytics that will be important to be driven at national level and also at regional level. We've talked about the importance of vulnerability, impact, and adaptation assessments, embracing these health indicators, ensuring that we have them well articulated and adaptive options well articulated through these processes. So we need to ensure that in addition to the VIAs that are necessary to show these overlays with climate data, that other health parameters are included in key policies and strategies going ahead. And there are various ways of doing that. Over to you. Patrick, would you want to chime in, or Ram?
Yeah, I'd love to now come in and speak specifically for the health sector. I think it's been mentioned in this meeting and other meetings that the health sector is largely underserved, whether you look at country level policies, processes, and guidelines. But critically, at the project investment level, we really don't have much to show, even as a Green Climate Fund. Just before this webinar, I was just presenting the GCF's fourth health-specific climate action proposal. So here we are talking of project investments in Laos, the Cook Islands, Malawi, and today we have a proposal that's on its way to approval for the Federated States of Micronesia. What is the problem? The problem is that in terms of readiness and preparation as a sector, we're doing poorly. At COP26, countries made a number of commitments to establish low carbon, climate resilient health systems. The first step of that journey is for a country to understand its climate context and how that is creating vulnerabilities for the health system and health and well-being of the people. And that is exactly what our Readiness Funds pool is set up to address. So really coming from this webinar, my encouragement to the audience would be to crystallize the changes on the process, whether you're looking at the direct access window, the DAE window, remembering the emphasis on country-led, country-owned processes, the emphasis on the role of the NDA. But for us, players in the health sector to be challenged to participate in country-level climate policy and processes, which, as Chihenyo has said, is a large gap at the moment. I think one thing that is important to highlight also, Antonius, is that with the new readiness formula, the funds pool that Ram was showing to us, the 4 million that could eventually go to 7 and ultimately even reach 10 million, that addresses many sectors across the board. So that whole 4 million is not just for health. However, it is possible for a country to justify, based on your baseline, the need to submit a readiness proposal to the GCF for a vulnerability and adaptation assessment that leads to a very well hosted and relevant health national adaptation plan, which becomes the foundation for project level investments that are relevant to your country context to the extent that they identify what the climate hazards are, what the impact of those hazards on the health system and services is, what the most afflicted regions are, the most vulnerable sectors of populations are, and therefore what the most relevant project level investments are, which is where then we come in. Yeah, so just to highlight that, please remember the large funds pool is for many sectors, but yes, we are agreeing that the health sector is underfunded, and therefore with WHO as a delivery partner and soon to be framework agreement partner, countries are welcome to work with entities like the WHO to present a health sector readiness proposal that would lead to the outcome of a current, relevant, and costed health national adaptation plan.
Thank you, Patrick. Can I hand over also to Elena? See her hand raised.
Thank you. I'm taking advantage of my position just to raise a few points because I found this presentation very interesting. And I have two specific questions. The first one is related to the potential challenge. Of course, I fully agree with the Green Climate Fund, and I applaud the strategy to make sure that there is more possibilities basically to support country priorities with this systematic approach to basically look at NAPs and NDCs and all the planning processes that are happening at country level, because we find this is also a critical gap when it goes to health. What for me is not so clear is how you're suggesting to have just partners, for example, at country level, is going to help or not specific technical or sectoral approaches. Because if this is the case, countries may decide to go to just one partner, for example, to support them to do everything, but then you lose the technical capacity of other partners. This is just my view, because maybe I don't understand everything, but this is something that I quickly thought, and it's the same because even at country level, the health sector is not usually called by others managing the climate change process to basically sit down at the table and strategize which the priorities are. So I'm sure there will be mechanisms for WHO and others to support the ministries of health to be sitting at the table and to support this direct access approach that, again, is very welcome. Second point that I found very interesting, because we are trying to do the same with the health, basically agreeing to your principles that country priorities are the ones to be supported also for health. I'm very interested to understand better about these country platforms for finance that you are establishing or supporting at country level. Can you just let me know whether those are basically funded by the Green Climate Fund, or you are trying to get additional funding to support those? Because, Patrick, this is something that we as WHO/attach would like to do better for health. And we were discussing potential possibilities to do this with the co-investment facility that we are developing. But I see that there is a clear synergy, or maybe it's just the case to support better health integration within these country platforms. I really think it's very important to support this, because that will really ensure that country priorities are really moved to advance pipelines or business cases. So I really think this is a very important point in your evolution.
Chihenyo, would you like to speak to the platforms question?
Yeah, I'll talk on the platforms, and I'm sure also Ram and Patrick will also add on to that. So Elena and also colleagues here, the country platforms is an idea that is being brought to fruition. As we might know, they do exist in some countries. This might not be new to some countries, but under the UNFCCC, there has been an interest to ensure that we strengthen coordination at the country level by bringing in various actors to really look in depth at climate finance related matters, and to strengthen it at country level through coordination by various actors across the public and the private actors. These are some of the recommendations that came out also from the last COP in support of advancing or mobilizing access and simplifying processes in some of the recommendations that came from the last COP. So the platforms themselves, the GCF is in the process of supporting them through the national designated authorities. In most of the countries, the NDA is actually hosted by Ministry of Finance, but in some countries, this might not be the case. Where they are hosted by Ministry of Finance, that could offer an opportunity to even strengthen them even further, because it's the Ministries of Finance that brings together medium-term investment plans and frameworks for every country. So they are responsible in consolidating that with various sectorial ministries. And also we do note that their programming capacities are relatively more advanced compared to others. So we are making a couple of pivotal changes that are still in discussion with our board. One of them is accreditation reforms. Again, we can't really speak much to it because we don't have board approval for that, but there are some proposals that are on the table on improving accreditation, particularly with the ministries of finance, and we're waiting for guidance on that. If that is approved by board, then these ministries of finance then would be even further supported in terms of programming and especially in convening these platforms. But I would like to state that the urge of having these platforms is really being demanded by the actors themselves. So we are getting through country engagement processes within the GCF. We are hearing various actors, direct accredited entities, both on the public and private sector, and also other actors who are outside our sphere, are calling for better coordination at the country level. And this call is something that we are deliberately trying to support using Readiness. So through the Readiness Programme, if you look at the strategy, you'll see 3 key objectives. One of them focuses on coordination, and this coordination is supposed to support and strengthen institution collaboration across the sphere within the national level, at the national level. And it's really there where the country platforms can be supported. So the NDA would be required to develop a terms of reference, as well as also talk what their country program would look at in terms of establishing a country platform. So in terms of resources to establish them or even to strengthen them, Readiness can be deployed intentionally for that. Over to you, Patrick.
Thank you, Chihenyo. Elena, the concept of the country platform is something that is very hot right now at the corridors at GCF, as Chihenyo has said. And yes, it does look something akin to the co-investment facility that we are working on for health and climate, except this would be at the country level. And the functions, as Chihenyo has said, are largely to play a coordination role. It can be at a sectoral focused country platform or a multi-sectoral country platform. One of the examples we have in South Africa right now is a water sector country platform. So we could have a health sector or other integrated multi-sectoral platform that serves a coordination platform, but also a catalytic platform that would bring climate financing resources at the country level to scale, looking at catalyzing resources beyond just grant instruments to de-risking, a de-risking window, as well as an investment window, just like we have for the health and climate facility. So if this is something that WHO has appetite for, networks for, capacity for, we would strongly encourage this as a next frontier mechanism to bring health and climate financing and actions at the country level to scale. But would like to, highlight, Elena, that going forward, it has to be a country-driven process. So it has to come from the Ministry of Health. It has to have the endorsement of the NDA, and preferably it needs to cut across sectors so that it's not just a single sector platform. Thank you.
Thank you so much to all the panelists for the very clear explanations. I would like to apologize to the colleagues that have joined because we have several questions that have been unanswered. Maybe I would like, first of all, to let you know that we will certainly be establishing an informative, frequently asked questions bulletin on the new readiness format. So we will make sure to incorporate all your questions on this. But also I would like to maybe propose to the GCF colleagues that at some point soon we could reconvene. We could possibly organize another webinar, maybe focusing on another region or even the same region, and maybe try to use some examples and make it more focused on a Q&A format, more friendly to a Q&A format, so that to understand and to explain also the several questions that exist. And I think they are very, it is very reasonable as we skip and transition to this new process. And the very important facts that you also mentioned, Patrick, in regard to all this reformulation of the country platforms. And as Elena mentioned, the necessity to engage the health sector in all these discussions at the country level. Maybe we could take one last question, and it is the last one that I see on the Q&A, and then I think we can close the webinar because we are already over time. So the last question is from our colleague Tito from Timor-Leste on who is involved in a country platform. And I think it relates to what we discussed also in this last round.
Chihenyo, would you like?
Maybe I'll start and then, yeah, I'll start and Patrick can also go in. So first of all, the formation of a country platform should be very organic. It should really be one that addresses the priorities that are needed at the country level. So far, we see that the role of the NDA, the National Designated Authority in country, would be to actually drive such a platform. However, that might not be the case for some countries because it really would depend on where the country sees itself. So who actually participates? Both public and private actors would participate depending on the agenda, the standing agenda of that time. At the same time, what drives the platform is really the delivery of key targets and priorities under the national designated, under the national determined contribution, or the national adaptation plan, or other sectorial policies would actually drive engagement as well as also drive the agenda. At the same time, we do see that these platforms could also promote both policy and regulatory frameworks for particular sectors, and could also promote more transparency, accountability, and governance structures in various aspects. So really, such a platform can be organic, can also be the kind that is demand-driven, but the various issues should really be centered within what is needed at the country. We recently came out from a climate change business summit that was held in Nairobi, and some of the things that the private sector across Africa were talking about in terms of driving such platforms would be the need on how they could advance private sector engagement. So they see their role, they see that they're interested, the private sector across Africa are really interested in having these platforms so that they can discuss about the key barriers that could unlock climate investments, and also how they could actually position themselves going forward in various particular areas of interest. They also talked about having closer relationships between government and themselves so as to promote a suitable regulatory frameworks that could support low emission carbon resilience development trajectories in particular sectors. So again, as health practitioners, I think this is where the opportunity is in terms of bringing to fore key areas of interest in that platform and driving investments to address these issues. But again, Antonio, the issue of data is very important. Please do come to those platforms with the data that is needed. Over to you, Patrick.
Thank you, Chihenyo. So for the health sector, Antonis, it will be critical for the Ministry of Health to be involved, but preferably we can see a whole of government approach where other associated ministries are involved in the platform, especially the NDA, ministry, whether that is a Ministry of Finance or Ministry of Environment, but other ministries that are in charge of the upstream determinants of health, Ministry of Water and Sanitation, Public Works, infrastructure. But beyond government, as Chihenyo has said, then you would incorporate the private sector, the not-for-profit sector, the civil service organizations in country, NGOs, international development partners, but critically, financing partners. We have said earlier how country platforms can serve as catalytic platforms that multiply certain seed money that's received in grant form by triggering de-risking and investment windows. So for that to go well, you would have to bring in banks that might be interested, investment organs in country. And really it depends. It depends on the country context, but it has to be a multi-sectoral stakeholder mechanism that brings in everyone that would be needed to drive the agenda forward. Ram, would you have anything to add?
Yes, maybe. Yeah, Anthony. I see a lot of questions in the chat. We can have a. I think I need to fix a meeting with you on the framework agreement. So we can anyway. We will schedule a meeting with you on the framework agreement follow up, and then I can probably address some of the questions which are related to readiness in case if you wish to do that. Yes, on country platform. Traditionally, if you ask us the legacy and now, the country coordination is a key priority for GCF for last 10 years. We have been trying to strengthen from scratch. We evolved. And now it is an opportunity where we wanted to move away from a traditional donor coordination mechanism to a mechanism which is going to help countries to access more climate finance. How it is going to be, whether country platform is going to be the right approach or something else, it's an experiment that we would be engaging. But certainly, as Patrick mentioned, there is a quite a lot of interest and attraction towards country platform, and probably as Elena mentioned, that's a good approach, or strategically for WHO that is a good area for you to look at because it's all emerging at the moment. In terms of follow-up, probably we will discuss based on our ongoing emails on the framework agreement, and we can also help you to make you clearer on the programming of the readiness. But if I wanted to communicate a message, please stay in touch with your regional colleagues, because for GCF internally, we don't want to operate any longer on silos. Chihenyo is going to be the focal for the countries where she manages, and she would liaise with the NDA, and we know exactly like how we are going to get the message from NDA, from AE, and from the regional team. So the strong message is to engage with regional team of us and with country, and then we can really help out in terms of strategic opportunities that is coming along the way. I can also discuss with Patrick and on the opportunities related to multi-country initiatives, which is I can see there are few, and these are some of the opportunities we can also discuss as we evolve. Thank you so much.
Thank you so much, colleagues. I don't know if Elena, you would like to add any final point.
Maybe just to reiterate that hopefully we will be working with our colleagues in the Green Climate Fund to respond to all these questions that we didn't have time to discuss, because I recognize those are all very relevant. And then maybe we can share them online. And thanks again to our colleagues in the Green Climate Fund. This has been super useful for all of us, and I hope we continue our collaboration.
Thank you. And as said, and considering that we have in front of us some very important processes like the NAP 2.0, the NDC 3.0, which are initiatives to which we are, which are very instrumental and important also for us. And of course, we see the opportunity on how the GCF can support this. I think we will make sure to be connected on the one hand and identify an opportunity to reconnect and bring together and continue this dialogue for supporting the countries towards this new operational modality, for supporting the countries to address those issues in a multi-stakeholder and multi-sectoral aspect. Patrick, I will hand over to you for the final word and the closure, if you allow me.
Thank you, Antonius. Colleagues, my task is to appreciate all of us for making time for this dialogue. First, I'd like to appreciate all the participants, the 80 of you that have stayed with us to the very end, but at one point we had a height of 107. Say thank you to my colleagues at the WHO, Elena, Antonius, Yiki, and others who are helping us with the direct translation of the webinar. Big thank you to my colleagues at the Green Climate Fund, Chihenyo and Ram. Appreciate you making time for this. And then my second piece in closing is to send out a challenge. That it is great that we've spent this time dialoguing about the needs for health and climate at the country level and the resources available through the GCF modality to respond to that. My challenge to us is that we should do all it takes to ensure that we do not make the webinar an end to itself. Last year, I'd like to remind us, the world breached the 1.5 degree temperature rise since pre-industrial era that's highlighted in the Paris Agreement. And highlight that to us that is a global average. When you look at temperature rise in Africa, in West Africa, in Southeast Africa, we are way above 2 degrees. What that means is that we will increasingly begin to see alteration of an expansion of the geographical and seasonal transmission of key climate-sensitive illnesses, including malaria and dengue fever. And coupled to that, Vibrio and cholera now is quite a phenomenon on the continent. We're going to see an increase in frequency and intensity of extreme weather events, flooding, excessive erratic rainfall, drought, and that will drive waterborne diseases. It will change more vector-borne diseases epidemiology and undernutrition. I have shared with us that for the GCF, which is really the world's largest climate financing institution, we have 4 country-specific health action proposals so far. RAM has listed to us the 9 countries, only 9 that have readiness projects with the GCF. That means our work is cut out for us. On our end, we commit to respond to as many questions that came through this webinar. Antonius, if you could please compile those and forward them to Ram, myself, and Chihenyo, we will happily prepare responses to those. But let's also come back together again. And when we come back together, let it be a sequential progression of the conversation, reporting on actions taken, and not just having webinars for the sake of webinars. Thank you, and I do wish you all a good morning, good afternoon, good evening. Thank you.
Thank you so much, Patrick. Thank you, colleagues.